fellow primary co-sponsors, Representatives Peter King and Bob Dole, in giving our mass transit commuters a break in these tough economic times. Thank you, Mr. Speaker, and I yield back.
The gentlelady yields back. The chair will now recognize the gentleman from Minnesota, Mr. Ellison, for 5 minutes.
Thank you, Mr. Speaker. I appreciate everything everyone has said about the defense of the Affordable Care Act, but rather than striking a statistical position or coming up with basically what was pretty humorous and entertaining by my good friend from Texas, I really enjoyed his presentation. I just want to talk about a person, and this is the person I want to talk about. This is a young lady from my district in the prime of her youth. She's only 25. And I'd like to talk to you about her a little bit, Mr. Speaker. Today we're going to vote to repeal the Affordable Care Act for the 31st time. We're wasting 2 days debating a bill that has already passed the House and has no chance in the Senate. Rather than spend our time creating jobs, we spend it trying to take health care away from those who need it most. One of those people, Mr. Speaker, is an individual by the name of Julie Doyle. This is Julie. Julie's 25, as I said, and her life has already been filled with numerous roadblocks. Julie had her first heart procedure at age 12, and for the last 13 years have been filled with many ups and downs, including losing her father when she was 15. Despite numerous health issues, Julie is still very active as the captain of her softball team, captain of her tennis team. She's a student council member and an active community volunteer. So as you can imagine, I think she's an amazing kid. Of course, she's not a kid, she's a young woman now, but she's still quite an amazing member of our community. Like many young people her age, Julie is dreaming of going to college, having a successful career. She wants to study business. Her efforts were derailed about 3 years ago when she started having multiple system disorders and started blacking out. There were days when she only had the energy to crawl from the bathroom. Concussions, bruises, broken teeth became routine. Just as her condition was becoming severe, her insurance was due to end. However, because of the Affordable Care Act provision allowing young adults to stay on their parents' plan until age 26, Julie was able to get the health care that she needed. Now, for the people who think it's so clever, so smart, so funny, I don't know what they think it is, to repeal the Affordable Care Act, I urge them to think about Julie. Julie's worth it. I yield back.
The gentleman yields back. The chair will now recognize the gentlewoman from California, Ms. Rabel Allard, for 5 minutes.
Mr. Speaker, this is day 2 of the misguided Republican attempt to repeal the Affordable Care Act. We have been down this road 31 times with the same arguments and the same often misleading rhetoric that does not reflect the true benefits of the Affordable Care Act. Those who argue against it are not speaking for my 167,000 uninsured constituents who for the first time will receive health insurance coverage when the law is fully implemented. And they are not speaking for the 7,000 young adults who can stay on their parents' insurance plans until they're age 26, or the 510 small businesses in my district receiving tax credits to help maintain or expand health care coverage for their employees. Colleagues who support the repeal of the Affordable Care Act are also disregarding the needs of minority communities where millions suffer from persistent and life-shortening health disparities. In my largely Latino district, for example, thousands more of my constituents will have access to health care through the expansion of Medicaid, the creation of health insurance exchanges, and through the law's expansion of community health centers. Mr. Speaker, my constituents do not want the Affordable Care Act repealed, nor do the millions of Americans across our country for which the ACA has brought life-saving benefits. This is most certainly true for women, seniors, and people with disabilities. Under the Affordable Care Act, being female can no longer be considered a pre-existing condition. Women will no longer have to pay higher premiums than men, and prenatal care will finally be covered for all women in this country. Never again will our sisters, mothers, and daughters have to choose between a mammogram or putting food on the table, because these life-saving preventive health services will no longer require a co-payment. As for seniors, last year, as a result of health reform, over 32 million seniors received free preventive health services, and over 5 million seniors have saved close to $4 billion on Medicare prescription drug costs as the donut hole closes. Because Obama cares, our families and neighbors with disabilities will no longer live in fear of reaching lifetime limits on their insurance or being excluded from coverage due to a pre-existing condition. Mr. Speaker, the Affordable Care Act is already working for my constituents, for women, for minority communities, and for seniors and people with disabilities. It is time for my Republican colleagues to listen to these Americans who do not want to lose their new health benefits. The Supreme Court has upheld the Affordable Care Act. Let's stop wasting time and taxpayers' money and find solutions to the other complex issues facing our country today. I yield back the balance of my time.
The gentlelady yields back. The chair will now recognize the gentlewoman from Florida, Mrs. Brown, for 5 minutes.
Thank you. You know, the Bible talks about the poor will always be with us. But our job is to help raise the standards. And I got to tell you, if it was not already invented, I would say this Congress invented the word do nothing Congress. Do nothing. Today is the second day that we are debating repeal of the Affordable Care Act. Let me be clear, not one single person have come to this floor debating doing away with it, don't have insurance, because we have the best insurance. And in fact, my blood pressure is up. I went downstairs because I have insurance. I was able to text my blood pressure and get some additional medication. And in fact, later I was able to go to the dentist because I have insurance. But what we're debating is you at home not having health care, because we, everybody in this House, every member that has come to this floor have health care. You know, every single president since Theodore Franklin Roosevelt for 75 years have tried to push some form of universal health care. And I want to thank President Barack Obama. And you know, they like to say Obamacare. I want to say President Barack Obama cares. President Barack Obama cares, and he was able to accomplish something. And let's be clear, the President proposes, the Congress disposes. So it had to be the Congress. It was a Democratic Congress, the Democratic Senate, and the President that passed the bill. Well, instead of discussing health care repeal, we should be debating VA construction. That's one thing in my state. As of July 1, the VA paid an additional $500,000 to rent a portable operating room for a project that is 95% complete, but we haven't had a chance on the floor to take up VA construction. We have 31 times that we're taking up repealing health care. I visited that facility last month, and I found out that it would have been a health safety not to expand the program for the veterans in that area. And often people say, well, what did the Democratic House President and Congress do? Well, we passed the largest VA budget in the history of the United States of America. We took care of the veterans. We had forwarding budget. We gave care to the caregivers for our veterans. And it goes on and on. You know, I really do believe to whom God has given much, much is expected. And he expects us to work to empower the American people. Jobs, health care. And basically, do nothing is the label of this Congress, the Do Nothing Congress. I yield back the balance of my time.
The gentlelady yields back. The chair now recognizes the gentleman from New York, Mr. Crowley, for 2 minutes.
I thank the Speaker. Today, Republicans in the House will once again bring up a repeal of the Affordable Care Act. We've seen a lot of repeal from them, but not as much with respect to their so-called plan to replace. But I think I figured out what the GOP wants to replace the Affordable Care Act with. Here is what I assume must be the Republican plan for health care in our country. Chicken noodle soup. Chicken noodle soup? Many of our mothers and grandmothers have told us that chicken noodle soup is a cure-all for anything. But I think the Republican plan takes Grandma at her word a little too literally. Can't afford health care coverage and need medical care? Have some chicken noodle soup. Been diagnosed with a serious disease and can't afford the prescription drugs you need to treat it? Have some chicken noodle soup. Well, at least you can rely on good old-fashioned chicken noodle soup. Have a pre-existing condition like diabetes that lets your insurance company deny you coverage? That's okay. Have some chicken noodle soup and you'll feel better in the morning. The truth is, it won't be all better in the morning. That's why we enacted the Affordable Care Act, to ensure that people could get the affordable, quality coverage they need, that seniors can afford their prescription medications, and that an insurance company can no longer deny you coverage because you have a pre-existing condition. I don't know why Republicans want to go back to the day when chicken noodle soup was the only option for hard-working families who couldn't afford care. The truth is, chicken noodle soup might be good for lunch, but as a health care policy, it is bad.
The gentleman's time has expired. The chair now recognizes the gentleman from Illinois, Mr. Lipinski, for 3 minutes.
Mr. Speaker, we have heard hours of impassioned speeches on the repeal of the Affordable Care Act, most defending all or nothing and pitting us against them. But the American people are interested in the politics. They want us to focus on what we can do moving forward to make good health care more affordable for them without breaking the bank. I believe the ACA is flawed, and I parted ways with the majority of my Democratic colleagues and voted against it in 2010. As I said then, the bill does not do enough to lower the skyrocketing cost of health care, cuts more than $400 billion from Medicare, is not fiscally sustainable over the long term, and breaks with the status quo by allowing federal funding for abortion and abortion coverage. But we all agree there are good provisions. The bill expands access to care and improved health insurance by doing things such as prohibiting discrimination based on pre-existing conditions and extending family coverage to children up to the age of 26. Why then are we being asked to blindly throw out the good with the bad, or alternatively, to simply let the law stand with no changes at all? A few months after I voted against the ACA, at a town hall meeting in Hickory Hills, I was asked by an opponent of the law if I would vote to repeal it. I said, no, we need a fix, not a repeal, that would take us back to the status quo. He said, okay, repeal and replace, keep the good parts, and make other necessary changes. I agreed, and that's exactly what I have been working to do. I helped pass into law a bill to repeal the burdensome 1099 requirement for small businesses and helped introduce and pass legislation to repeal the ACA's Class Act program, which would have added tens of billions of dollars to the deficit. In addition, I worked to pass legislation to ensure that no taxpayer money is spent for abortion under the law, and I continue to fight against portions of the HHS mandate that violate Americans' religious liberties. At the start of this Congress, I hoped we could work on major fixes to the health care law. Instead, a bill was brought to the floor in January 2011, which would have eliminated the entire law with no exceptions. I opposed that bill. I voted for a resolution instructing 4 House committees to develop replacement legislation. Yet 18 months later, there still is no replacement. Instead, we are again voting on a repeal, period. And once again, we all know this bill will pass the House and die in the Senate. A Chicago Tribune editorial recently stated, if Democrats want to save the ambitions of this law, they're going to have to find a way to write a truly Affordable Care Act. And the Tribune concluded that Republicans ought to engage Democrats in a real effort to contain the cost before the law takes full effect in 2014. I wholeheartedly agree. Let's stop the posturing, roll up our sleeves, and work to make health care more affordable for all Americans in a fiscally sound manner. That is what the American people want us to do. That is what we need to do. I yield back the balance of my time.
The gentleman's time has expired. The chair now recognizes the gentleman from Missouri, Mr. Clay, for 3 minutes.
Thank you, Mr. Speaker. I cannot believe we are asked for a 31st time to repeal the Affordable Care Act. This isn't just a policy issue. This is a moral test. This is one of the great moral tests of our time. And those who vote to repeal the Affordable Care Act are failing that moral test. They are utterly failing that test. Paying health insurance premiums and other health care bills has become very difficult for American families. Premiums have gone up each year, and the cost of health care has escalated. Insurance companies have shifted costs to consumers through increases in deductibles and co-payments and decreases in covered services. Low and middle income families need relief from skyrocketing health care costs. The ACA, the constitutional ACA, provides real relief to American families. First, the Affordable Care Act provides direct financial relief to millions of insured American families that struggle to pay health insurance premiums today. The new law allows families to shop for a plan in new state insurance exchanges, and it allows them to receive a big discount on their premiums. The ACA protects people from high deductibles, high co-payments, and unexpected gaps in their insurance coverage in 3 ways. It eliminates lifetime and annual limits on how much an insurance plan will pay for covered benefits. That means payments won't suddenly run out. It caps how much a person must spend each year on deductibles and co-payments for covered benefits. That means that families won't be forced to lose their homes because they get sick. And it provides additional help with out-of-pocket costs for lower-income families. Second, the ACA expands affordable insurance options to families who could not afford coverage before. Medicaid now will be available to families with incomes at or below 133% of the federal poverty level. For people with incomes above that level and up to 400% of poverty, the new premium tax credits will help them afford coverage. Reducing the number of uninsured will reduce the hidden health tax that is imposed on insured families. We all pay higher premiums to pay for care of the uninsured. Third, the Affordable Care Act will slow the growth of underlying health care costs and help all Americans. As I have said on this floor before, the ACA is the greatest improvement in women's health in decades. Under the ACA, millions of women are gaining access to affordable health care coverage. Women will not have to pay more than men for the same insurance policy, and women will not be denied coverage because they are sick or have pre-existing conditions. Women will be guaranteed preventative services such as mammograms and cervical cancer screenings with no deductibles or co-pays. Mr. Speaker, I yield back.
Gentleman's time has expired. The chair now recognizes the gentlewoman from the United States Virgin Islands, Ms. Christensen, for 3 minutes.
Thank you, Mr. Speaker. Just to set the record straight, I'm a family physician and the first female doctor in the Congress. Just less than 2 weeks ago, the Supreme Court issued a final ruling that the health care reform law is in fact constitutional. It is now the law of the land. Despite this, today my colleagues on the other side of the aisle are revisiting old political battles instead of using the final weeks in this session to fully implement a current law that will protect the health of every American. Instead of creating jobs during a time when unemployment is at a persistent high, instead of strengthening the American economy and ensuring that taxes on the middle class are not raised. I've heard the scare tactics and spin that my colleagues are using to mislead the American public. The truth is this: repealing the health care reform bill would set this country back on a course no American, Republican or Democrat, wants to go back to. With the list of horrible consequences, H.R. 6079 reads like a dishonor roll. The Republicans' repeal of health care reform will raise taxes on 18 million middle-class people. More than 6 million young adults will lose the option of being covered under their parents' health plans. More than 5 million seniors will pay more in prescription drugs, leaving many having to choose between paying their rent, food, or their medicine. 129 million Americans, 17 million of whom are children with so-called pre-existing disease, which before health care reform included acne and pregnancy, may be denied health care coverage when they need it, and 33 million currently uninsured Americans will stay among the ranks of the uninsured. More than 32 million seniors and 54 million other Americans will pay more for mammograms, colonoscopies, annual wellness exams, and other often life-saving preventive care that detects cancers and diseases at their earliest stages when they're most treatable. 105 million Americans would again have lifetime limits on their health insurance, which often puts health care services out of reach when people need it the most. And 15 million Americans would be dropped from their insurance companies altogether. Many of the provisions of the law may never get funded that would close the shameful gaps in health care that cause people of color, the poor of every race and ethnicity, even those who might be Republican or Tea Party, rural Americans, and those who live in our nation's territories to die in excess numbers from preventable deaths and cost the country billions of dollars every year. There's nothing appropriate, just, fair, or worthy in this attempt to repeal the Affordable Care Act. It turns back progress. It closes a door to wellness that is now just being opened to over 30 million Americans. It sets this nation on a path that is unhealthy and less financially secure, and it threatens our position of leadership in the world. Even though we know this is just an empty exercise, that it's not going anywhere, we do have the opportunity to stand together and do the right thing, to not let bad politics drive bad policy. When that bill comes up for a vote, vote no on H.R. 6079, and I yield back the balance of my time.
Thank you very much. Pursuant to Clause 12A of Rule 1, the Chair declares the House in recess until high noon today.